What's up, guys? How's it going? Cade Moore with More Muscle. Currently a nursing student. I want to become a doctor. Today we're going to be talking about generalized anxiety disorder. So this is, guys, in today's world with all the screens and electronics, a lot of, anxiety going on. So we're going to be talking about some certain things about generalized anxiety disorder, what we can do, and how we can prevent this. So this is a mental health condition. It consists of lots of fear, feeling of being overwhelmed, and it can happen to children, it can happen to adults, and talk therapy and medications are usually the answer to do this. Most people with generalized anxiety disorder, they have like major depression, they have phobias, they have social anxiety disorder, or they have panic disorder. Guys, panic disorder is when you can't do proper things and you can't focus. So when the anxiety gets so high, you can't think, you can't make educated decisions, and that can be harmful. So guys, a lot of symptoms we see is restlessness, feeling on edge or irritable, being easily fatigued, shortness of breath, heart palpitations, difficulty concentrating, muscle tension, bless me, difficulty falling asleep or staying asleep, headaches, muscle aches, stomach aches, or unexplained pains. So guys, this is not something you want to have. There's a lot of things that you can do to prevent this, and a lot of you can experience generalized anxiety disorder from experiencing a traumatic event, being in a stressful environment, having to manage chronic illness, experiencing child abuse, something like that. So guys, if you want to get diagnosed with generalized anxiety disorder, it's usually excessive anxiety for at least 6 months. Has difficulty controlling the worry. The anxiety results in significant distress or impairs daily function. The anxiety isn't due to physical causes such as thyroid issues or substance use. So what you can do is you can get a thyroid blood test, blood glucose test, echocardiogram, heart test, drug test. These can all help, because the echocardiogram, that's a heart test. It can tell you like if you're having arrhythmias and stuff, if your heart's working well, because when you're anxious, your heart's not, it's gonna be tachycardia, which is like a fast heartbeat, and you're gonna be breathing, your respirations are gonna be higher, over probably 20, because the normal is like 12 to 20. Normal heart rate's about 60 to 100, so if it's above like 100, that could be something with generalized anxiety disorder. So guys, there's antidepressants you can take, serotonin reuptake inhibitors, and guys, I would try to solve your anxiety. If you are having consistent anxiety, I would try some other things before you do antidepressants. Guys, antidepressants are very hard on the body, let's just say, and you can get like serotonin syndrome, which is just terrible, and you can get a lot of other problems from these antidepressants or whatnot. The crazy thing is sometimes they prescribe lithium, and that helps with mental issues. Lithium, you got to make sure you're watching your salt intake. You want to be getting enough salt, because lithium kind of drains that salt from you. Then there's also like other anti-anxiety medications that usually make you tired too. So if you do have a serious anxiety problem, I would much rather you try and solve it naturally before trying these drugs, because that's gonna cause you some side effects that you might not want, and I think there's much better ways to handle things. So guys, so for example, if you have anxiety, and let's just talk me and you. So if I had anxiety, I would make sure I'm getting enough nutrition. I don't have any health problems like thyroid disease. Thyroid can increase that anxiety risk. I would make sure I'm sleeping good. I would do everything I can to stay healthy, and that's going to decrease your chances of anxiety. And another thing is you gotta stay busy. Being busy is gonna distract your mind from anxious thoughts. And if you can combine that with healthy eating, going to the gym, going outside, sleeping good, I guarantee you 90% of anxiety and depression will be gone. That's what I'm 100% positive. The people that I see that have anxiety, they're inside watching TV for hours a day. They're on their phone for hours a day. They're not sleeping good. They're not busy. They're not working. And those are the people that I see with anxiety the most. So I think the best antidote for anxiety, if you want to naturally get rid of it, is work, eating healthy, sleeping good, exercising, taking care of your health. What's up, guys? Sorry, my phone glitched out. It says my storage is too full. But anyways, let's get back to it, guys. So if you're taking care of your health and you are, working and you're keeping your mind occupied, you're physically working and you're growing, you're getting smarter, you're growing your brain, you're going to be okay. That anxiety, I guarantee you, will go away like 90% of the time. But if it doesn't, then yeah, you might need to take some antidepressants. You might need to take some other things. But anyways, guys, thanks for watching and subscribe.